Hello, Dr. Corana.
Hello, nice to see you again.
Nice to see
Thanks
you
for
too.
having us again.
Welcome.
We had amazing feedback and people want to learn more on how to
Cool.
take care of themselves.
That's great to hear. So, what are we going to discuss today?
You tell us.
No, I know.
You know?
You know.
I do.
Ta kif ta?
Because I do research. But even you know. Come on. Chemical peel.
So, we're going to discuss something a little bit more invasive, if we can call it that, or something which can be a little bit more aggressive.
Aggressive.
Pigmentation, acne, chemical peels, treatments.
Exactly.
What is chemical peel?
Exactly what it sounds like. So, it's a peeling of the skin,
The
which
first
is
layer.
done by chemicals. First layer, second layer, there's different types of peels. We have superficial peels, medium peels, and then we also have deep peels. But deep peels have been recently kind of put to the side because they have a lot of side effects and we get more harm than good. So we mostly do superficial and medium depth peels.
Can you explain both?
Yes, so superficial peels are treating superficial issues. So little fine lines, superficial pigmentation.
Caused by
what is superficial
Oh,
pigmentation?
right. So our skin contains special kind of cells which produce pigment. We call it melanin.
Melanin.
And
The
exactly,
hair.
it's responsible for all the pigment in our hair and our skin. When it's overstimulated, and this can be due to a number of reasons, mostly it's the sunshine, and in Malta the sunshine is.
Yes.
What happens is these pigment producing cells get overexcited and they start spewing out little bubbles of pigment. And this pigment starts to slowly go to the surface of the skin, and that's why we start to see it. So superficial peels can treat these very superficial type of pigments. They're generally small, light, and react very well to superficial chemical peels. Deeper or medium depth peels are going to treat other concerns. They're going to treat deeper pigmentation, so the pigment can get stuck either in the superficial layer or in the slightly more deep layer.
And how would you know?
We use a woods lamp. It's a special kind of light,
Okay.
which when we shine over the face or wherever the pigment is, the pigment changes color depending on its depth.
Okay.
It will reveal itself.
Exactly.
Okay.
And that's a really important thing to do before starting any kind of process or treatment for pigmentation. Because it's very easy to treat superficial pigmentation.
Of course.
Peel it, couple of days, and it's fine. Unfortunately, a lot of people have either deep pigmentation or mixed pigmentation types, which respond very badly to inflammation. So let me explain. If you have a deep pigmentation, you put a peel over it. The peel is going to cause some damage to your skin, obviously, and the body is going to respond by causing some inflammation. Inflammation and factors of inflammation actually go to these pigment-producing cells and they tell them, panic, start producing more pigment. Pigment is a protective substance. It's fascinating how the body works.
Which protects the skin.
Exactly. Pigment is there to protect the DNA of every cell from external damage, such as sun. Because sun can damage the DNA of cells, the genes of the cells, and cause other problems. So we have this pigment as a protective mechanism. Of course, aesthetically,
You want to destroy it because aesthetically is not nice.
So these deeper pigmentations, we have to be very, very careful. We have to make sure that we can recognize what type of pigmentation it is. It's not just the sun. A lot of these pigmentary disorders are inflammation, hormones, genetics, etc.
Freckles?
Freckles are genetics. Freckles are superficial pigment, and
Can it start with freckles? Pigmentation?
What do you mean, can it start?
You would see some kind of freckles on your face?
Yes,
perhaps?
yes, it can start from freckles, but freckles are genetically determined most of the time, and you're just more prone to develop freckles if you are exposed to more sun. A lot of people with freckles realize that they get more freckles in the summertime and kind of have lighter freckles in the winter time. The deeper pigmentation is, as I said, we have to investigate why it happened. A lot of women who just have children postpartum get these hormonally influenced pigmentary disorders. A lot of women who start oral contraceptive pills or get off oral contraception also have these fluctuations in their hormones that
Change of
affect
hormones.
exactly.
Adolescence, maybe, or not.
Not so
Okay.
much, not so much.
Late 20s, perhaps?
Yes, yes, because, well, in adolescence, yes, you can have younger girls who are on oral contraception, but generally it's 20 plus that we start to see it more
Does
frequently.
pinching affect the damage of the outer part of the skin?
So if you have like a pimple or something,
Uh-huh.
yes, back to the inflammation. So when you pick a
That's
pimple,
inflammation.
Exactly.
you're causing inflammation in the skin. Any kind of pigmentation, inflammation in the skin is going to make you more prone to pigmentation. So that's why you have a lot of people, I'm sure that we've all seen them, they've got these brown acne scars. They're not even those classic ice pick or box scarred scars. They're brown. And darker skins form even more pigmentation post-inflammatory. And we actually call
So
it,
the darker the skin, the
Yes.
more prone.
Of course.
because they have more pigment. They
course.
have more pigment. So we call it post-inflammatory hyperpigmentation. It's actually
And you
a
can see it even on the
diagnosis.
back.
Back. Or
Face.
if you have a scratch, if you have a mosquito bite, if you are at the beach, cut your leg, and once that scar heals, it heals brown. That's all post-inflammatory hyperpigmentation. And chemical peels can help with all these types of pigmentation, but we have to be very precise when we diagnose where the pigmentation is coming from.
Yes.
And then obviously we have all the selection of all the different types of chemical peels. It's not just one chemical. There's single chemicals which we use, and we like to kind of start from a low grade and then get the skin
Gradually.
used to exactly that peeling. And then we have these combo peels where we combine 2, 3, 4 different types of acids, and we target different needs.
That is why it's so important to know what you are doing and to leave
To professionals.
yourself into the hands of a professional.
Exactly.
Yes.
What's the procedure? When a person comes, there's a consultation, obviously.
Exactly, yes. So after a consultation, after we've determined why the skin is pigmenting, we agree on the best peel. I like to ask people how much recovery time they have.
Okay. So
Very
you need
important.
recovery
It's a game
time.
changer.
Yes, so the superficial peels obviously need much less downtime. We're talking about a couple of days. Everybody's skin is different. The more medium depth peels, they can take about 10 to 14 days to heal.
They have to stay indoors.
Ideally,
Yes.
yes. Which is not to say that you can't leave the house. You just have to stay away from sunlight. Your skin will be peeling, so you will want to stay at
You
home.
will want to stay.
Yeah, but it's really worth those 10 to 14 days to get the results that these chemical peels can give.
For the superficial one, no.
No, for the deeper
For
ones.
the
Superficial peels,
Couple of
I
days.
have a lot of clients with acne. So apart from
Exactly,
medically treating
exactly.
their acne, we're also aesthetically treating their acne because people are debilitated
The
by their
aftermath
acne,
of the
especially
acne.
when they're young.
So we spoke about pigmentation, but as you said, yes, chemical peel.
Yes, we can also use it for acne, active acne. Obviously, again, very carefully, we have to grade the acne. We have to see whether it's realistic to perform a chemical peel, whether the clients are going to get some benefit from this chemical peel, whether we're going to make more harm than good. So it's all, every person is different.
It's a
Every
case
skin
study.
is different, every acne is different. And it's so important to understand that what somebody does for one condition.
Exactly, it's not one size fits all.
Exactly, it's not a one size fits all. And I think that's the beauty of it, because otherwise we just be performing the same 4 things all over
Yes.
again.
What is the best time of the year to do these chemicals?
So in Malta, we're super careful. as I said, the pigmentation that can happen post any kind of inflammation is serious. So we tend to aim for November, December, and then we go on through to March, April. Depends on the year, depends on the lifestyle. We ask everybody what they do, where they're going to spend their Christmas holidays. You know, it's wrong to assume that people are... Exactly. It's wrong to assume that people in December are going to be somewhere cold. A lot of people are traveling, a lot of people are going to warm destinations in December. So, and if you plan it out properly, then it's very safe.
And there is a lighter color of pigmentation, right? Not the darker color only.
What do you mean?
If not mistaken, like white pigmentation.
When it loses melanin, I think that.
Like white pigmentation? I didn't understand.
When the skin turns white.
That's another condition.
So
the body starts forming antibodies, which are specific proteins that actually attack and eat the melanocytes.
So we're not talking about that.
No, this is an autoimmune disorder. Which
what is the aftercare? So
aftercare, superficial peels, again, always sun protection, super important, and moisturization. Your skin is going to peel because it's going to be dead on the surface. So you get a bit of flaking, a bit of redness, a bit of itching maybe, tightness.
Yes, exactly.
So moisturizing and a good sunblock, that's it. Superficial peels. Deep peels, it depends. Depends how much people are peeling. Sometimes we have people who really peel a lot.
It depends on how the skin will react.
Exactly.
Everybody is different.
Exactly. We follow people up, we make sure that their skin is clean, not infected. We treat any kind of infections or inflammations.
How many sessions do you do?
The deeper peels, one or two maybe, and they're spread at least about 6 to 12 months apart.
Okay.
The superficial peels, generally it's one every 6 to 8 weeks. Depends again what you want to achieve. But yes.
It's amazing.
Namlu wkoll, namlu kollox aħna.
Putting down.
We're jotting down appointments. Thank you very much.
Thank you.
You're very welcome.
Thank you so much.
Very welcome.